Hello and welcome back to Craving Healing. In today's video, we have an interview with the registered dietitian Ms. Cassetta to discuss eating disorder recovery and the role of nutrition in healing. Ms. Cassetta shares her valuable insights on how to approach recovery and take the first steps forward to a healthier relationship with food. If you or someone you know is struggling, remember that help is available. We hope this conversation brings support, understanding, and hope to those who need it. I hope you enjoy the interview.
Okay, thank you. So I'm Victoria,
And I'm Maya.
and we're basically part of HOSA at Research Triangle High School. And our team is passionate about raising awareness on eating disorders and how they impact young people. So today we just wanted to dive into the role of nutrition and recovery and prevention.
We only have 30 minutes with you, but before we dive into our questions, could you tell us a little bit about your background and what inspired you to have your career as a registered dietitian?
Yeah, absolutely. So my name's Nina Cassetta. I became really interested in dietetics. I actually used to professionally figure skate for about 15 years. And so I was in a prevalent community where there's a lot of eating disorders going on. And so that kind of inspired me to kind of learn about nutrition. And, it was a really eye-opening experience to kind of realize how harmful eating disorders can be for the human body and how, as a young person, you think it makes you perform better and all these things, and it actually harms your body, and it can harm your body in development as you grow older. And it was really sad because I saw a lot of my friends go through it as well. So I just decided to be a dietitian and work with this population because it's a personal, a passion for me to kind of help people with their eating disorders. But I kind of started out in college. I graduated from Appalachian State University. That was really fun. I did their didactic program. And then I went and did my internship at the University of Oklahoma. So that was like a year-long, clinical rotation, community rotation. We got to choose and pick some other things to do. And so I was really passionate about the eating disorder community. So I got to work with a couple eating disorder kind of programs in that area. And that really opened my eyes to being okay, this is definitely what I want to do. I was able to get along with a lot of the patients. They felt very comfortable opening up to me. And I think that's a huge part about working in the eating disorder population is that you feel comfortable and that they feel comfortable with you. That repertoire is the most important thing that you have to establish. And letting people know that you're their friend and it's okay and that there's no judgment. A lot of people work with a dietitian and they're really scared that they're going to be harsh, or they're going to be okay, well, let's do this, this, and this, and this, and that can be overwhelming. So taking baby steps, learning about their history, learning some personal things about them is a really big deal too. Sometimes we'll share each other's pets. That's my favorite icebreaker a little bit is talking about our pets, because that's one thing that everyone can kind of bond on. And so, going to the University of Oklahoma and graduating from there was a great program. But Appalachian State was by far my favorite for my didactic program.
That's so cool.
Yeah.
Thanks. Yeah, I did a little bit when I was working with that program. When I came back, I actually started working in the NICU for a little bit as an intern, just to kind of see if I wanted to do eating disorders or NICU. And I liked both of them, but I was I think eating disorders are my bread and butter for where I can help the most personally. Yeah. And so that was really fun. And then I came back and I worked for a hospital for a little bit. So I have that clinical experience. And then I left and then I did private practice. And I think private practice was the most self-rewarding, because in the hospital, you can't really form a really good kind of relationship with your patients. But in an outpatient, they choose to come see you. They don't just get a visit and they're dealing with a lot of stuff. So that personal relationship was so important to me as a dietitian.
So our next question is, what are some of the biggest misconceptions about nutrition and eating disorders that you encounter in your practice?
A lot of misconceptions that I have is that, dietitians are super strict and they don't understand, or, they have a set plan where you have to follow these, specific things in order to recover. But recovering is your own speed. It's about your own comfort, trying to see progress, trying to learn about why food is good for you. A lot of people are, when they have eating disorders, their brain tells them that food is the enemy and that there's not a lot of good things in food. But fats are so important, protein is so important, starches and carbs are so important. So I kind of go through the benefits of why these foods are necessary.
So from a nutritional standpoint, So sorry. How
No, you're
does
good.
social media impact like people's relationship with food, and what can be done to promote healthier messaging?
I absolutely love that question because I think that is the number one thing that impacts like young people because a lot of people will see social media and they'll see influencers and it's all about marketing and making money off of people and people don't realize that they're being preyed upon, especially like really vulnerable people like eating disorders and stuff. So they'll see their favorite influencer like trying to influence like let's try this new fad diet or let's fast or let's not eat this or they'll start trashing like food and it's like there's no such thing as good or bad food. There's food in moderation and food you can enjoy. And, there's so much community and love in food and making food. It's like an act of service when you make it for someone and such a special experience when you share it with someone. So I always tell people if you're on social media, be very careful about who and what you follow. You should only be taking nutrition advice from dietitians. And this is the big misconception that a lot of people don't realize. There's a huge difference between a nutritionist and a dietitian. You don't have to have a license, like a medical board license when you're a nutritionist. But when you're a dietitian, you do need to pass a test and it's very standardized. You have to do this internship. It's very hands-on. So the biggest difference is that a nutritionist doesn't have as much experience hands-on clinically with the body, stuff like that, that a dietitian has. Dietitian's allowed to work in a hospital and a nutritionist is not. So I always tell people, make sure that you're working with a dietitian mostly overall and not a nutritionist because a lot of people can claim to be nutritionists but they don't have the licenses or the medical background to do that.
From a nutritional standpoint, what are the most effective strategies for helping someone recover from an eating disorder?
So I always kind of like to start out of figuring out what their eating disorder is. So finding out what kind of like triggers them, the foods that cause, a little bit of emotional discomfort, the things that go along with making sure that they know what nutrition does for their body. So we kind of go over why food is important and what it does for your body, and that, each little thing does help with your mental health, your bodily health. Like there's so many connections in that point. And then the second one is going through the cycle of like what happens and how it's like a vicious cycle and it just repeats, and how that your brain can kind of be the enemy sometimes. And you have to kind of like negotiate with yourself until you feel comfortable with food and get that better food relationship.
If you don't mind, could you walk us through the steps that you would do with the patient?
Yeah, so whenever I start with an initial consult, I kind of like it's usually about an hour that I kind of start with them. I kind of talk to them, introduce ourselves, do a little icebreaker, ask them, why they're here. And so they kind of let me know, they kind of talk to me. I never assume things. That's the most important thing as a dietitian, that you never assume something about someone. You let them have the comfort of talking to you. Even if it takes 2 to 3 sessions, breaking that ice and making them sure that they feel comfortable with you is the most important part. So I kind of go over, what they've done in the past, if they've ever had like any laxative abuse, anything like that, the triggers that they have, trying to avoid certain foods that might, cause them to relapse, or where they are in their mental health, if they're seeing a therapist, like if I can have their therapist contact number. And, we do that like HIPAA agreement to kind of make sure that we're talking about the patient in a secure way. So that way we can kind of help them in their journey and, their progress. Kind of go over medications, go over, what the weight history is like. So we can kind of see like what's been going on and for how long it's going on, because the longer that you have an eating disorder, it's harder to break, but it is possible. That's the one thing that a lot of my eating disorder clients do ask me, like, is it possible for me to see recovery? And I always let them like, absolutely, it is possible. It takes a lot of work, but it is absolutely possible. So there's a lot of reassurance in that too.
I think it's really cool that like you're really trying to connect with like each individual personally, because everyone has like their different journey in like eating disorders, and also everyone's body is different. So I just think it's really cool that like you're really trying to connect with each person.
Yeah, and thanks for saying that too. And it's a very complex kind of like environment to work in, because there's many different eating disorders. There's ARFID, which is like avoidant restrictive food intake disorder, where you don't like certain foods, you can only eat a certain food in their brain. Anorexia is where they're too nervous to eat, they don't have those hunger cues anymore, they don't realize the harm that they're doing to their body. So that's anorexia nervosa. And a lot of big misconceptions are that you have to be a certain size to be considered anorexic. You can be anorexic in a certain point or have a different eating disorder like ARFID, or orthorexia, which is like when you're very health conscious and you think as food is the enemy. You don't have to be a certain weight for those categories. Only I think anorexia nervosa is the one that's like really looked at a standpoint to weight that just is like a dangerous BMI that you don't want to go below because that can stunt your growth and stuff. But there are many, many eating disorders out there. So I like to tell people that, the awareness of it being out there is super, super important.
Yeah. So, how can schools and communities provide better education on nutrition and eating disorders to like support prevention and recovery?
I think a lot of schools should probably have a curriculum in nutrition because like when we're in school, we don't really learn too much about nutrition. And we have our peers around us and they're always looking at labels and talking about, oh, this is not a good food, or, I shouldn't have this, or this is bad for me, or, why are you eating that? And your peer kind of environment makes a huge impact on how you kind of see food. So I think it's really smart for schools to kind of do a nutrition program, have a dietitian kind of talk to them. They only need about like an hour, 2 hours, or a whole, like, they could do even like a mini, they have those like specialized classes, something like that. We're doing something once a month that talks about nutrition and why it's important, especially for like teen athletes and stuff like that. When you're in school, like you need those things to kind of perform very well. Even in school, when you're studying and you're taking tests, like you need proper nutrition to do well. So I think specialized classes, having even just a speaker come in, a guest speaker, that would be important. And then I think that lunch times should be given a little bit more time because I feel like in the younger populations, I even remember when I was like middle school, high school, those lunches are so fast that, we kind of learn to override those satiety cues when we're children because it's always, you should clean your plate, you should do this. It goes into guilt and shame of like if you don't finish your food, and it can kind of cause anxiety around it. Also, making someone finish really fast can also lead to another like binge eating disorder. So I always tell people that it's super, super important to kind of like take time to eat, don't rush yourself, really enjoy the food, and then fall within yourself to see like where your hunger cues are at.
Yeah, I personally had orthorexia and I would always rely on like social media to like figure out which foods were considered bad and good. So that led me to like restricting a lot of foods from my diet. So I think like having an extra like curriculum would be so helpful in that and like actually learning like what's like good for your body, both physically and mentally.
No, I 100% agree. I think it's really important. Like, if anyone has an eating disorder, like working with a dietitian is like the first step of like acknowledging what foods and that all foods are, safe to consume too.
Yeah.
For our final question is, for young people struggling with eating disorders but are afraid to ask for help, what small steps can they take to improve their relationships with food?
That's a really good question. I don't think I've ever been asked that, but I think that the first kind of step in recovery is admitting that you have a problem. A lot of eating disorder clients that I kind of work with kind of like hide, what's going on. They like to get very defensive about it, and it's about, relaxation. Like no one's out to get you, no one's gonna make you do something. It's just like that comfort of talking. So building that repertoire with that person is so important, kind of like talking them in and talking about like, why foods are okay, and like, talking about, like I said, I was like balancing nutrition and how you need certain food groups and doing that nutrition education on macronutrients and what happens when you don't give your body the proper like macronutrients that can cause a lot of issues. So I always tell people that like, starting with the basis, starting to like, admitting that you have an eating disorder, working with a dietitian. And third, I would say probably is like working on your journey, trying to improve your mental health. Even therapy with a dietitian is very, very helpful.
Yeah. Yeah. So that's all the questions we have for today. So we appreciate your time and the work you do to support individuals supporting with eating disorders. This conversation has been so helpful, and we really hope to use this knowledge to raise awareness and make a difference in our community. And again, thank you for being here with us today.
Thank you.
Yeah, thank y'all for having me. I hope you have a great day.